everyone. I chose Chapter 11, focusing on substance abuse, to present for my teaching assignment. Drug use in juveniles differs greatly from drug use in adults. This is because their physical development, along with their brain development, presents even more harmful effects for the individual's bodies. And age of reason is something that really contributes to juveniles making the decision to participate in drugs, because they can't make rational decisions and consider the consequences of their actions. So they're very susceptible to peer pressure and whatever factors are around them. And parents and their interactions with their children are very important to determine whether a child will use drugs, because parents are often expected to control their children's behavior and not allow for drug use. So they should advocate to not legalize drugs for youth, just based on the health and mental effects that it has. Tobacco is not legal for youth under 18, yet it still remains a huge health problem. And those who start smoking at a young age have a more difficult time quitting. And prevention centers have implemented policies to reduce young people smoking through media campaigns and school-based prevention programs such as DARE and community interventions and hiring costs for tobacco products. Alcohol is the most common mind-altering substance, and the advertising for alcohol is often aimed at minors, and whether they are playing a commercial in the daytime or on a younger audience television channel. So now there's been policies implemented where the alcohol industry can only play advertisements on certain channels or at certain times, so that minors are probably not watching. And alcohol has effects on juveniles in many ways, including school, social, legal, physical, and suicide, memory problems, many health and criminal related problems. Marijuana is the most commonly used illegal drug, second to alcohol and tobacco, and this should remain illegal for adolescents because of the physical and emotional maturity that they have. They're not ready to be exposed to marijuana, and their brain hasn't fully developed. And this exposure can cause mental and physical impairment and makes users unaware of dangerous situations. Meth has effects such as addiction, violent behavior, anxiety, confusion, and there's a cycle that I see here with meth, is that a great deal of it is people are committing crimes such as robbery in order to obtain the money to buy meth. So they're committing one crime in order to obtain another illegal possession. And inhalants are a big problem because they're so inexpensive and easy to obtain, as they're often found in households. It could be cleaning supplies, aerosols, fumes, really anything that has these chemicals, and children are getting their hands on it because it's just below their sink and all the cleaning supplies, and it's hard for parents to notice any use of these inhalants because they could be used to clean, but they just don't know. And the problems could be as severe as chronic and acute effects and death, brain, and lung damage. So these are very dangerous drugs. Along with prescription drugs, youth can easily obtain these as well. You often see prescription drugs in parents' medicine cabinets, and it's difficult for parents to detect youth using these because they'll often only take one pill or a couple pills, and parents don't really count their pill bottles, or they don't notice a big change, so they don't even question it. So this is definitely something that parents have to keep in mind and keep pretty safely closed if there is prescription drugs in their cabinets. And these drugs could be opioid, painkillers, sedatives and tranquilizers, or stimulants. And this causes poor judgment, insomnia, depression. And the most effective way to prevent this is, again, when parents are vigilant. Performance-enhancing drugs are often used by athletes in order to improve their strength and athletic ability. And this is often seen in steroids, hormones, stimulants, and that there is well-documented health risks of these drugs, which include heart problems and digestive and reproductive system issues, and again, affecting their behavior. Influencing factors that are really important to consider are peer pressure, family, and neighborhoods. Peer pressure is something that affects juveniles greatly, whether their friends are drinking and smoking and they want to participate in the social norms, and they are trying to establish an identity within their group. Family is a big influence on how children are raised, and if parents are poor role models, or if they're drinking and smoking, then the children will often see that activity and consider it normal, even maybe approved. And neighborhoods are also another factor to consider, whether there be few job opportunities in the neighborhood or drug selling. This leads to individuals in the neighborhood just kind of picking up the activity that they see and hoping to be accepted. And this relates to the social learning theory, as it explains that people learn behaviors by watching other people. So when juveniles see their parents doing something, they often want to follow. And it also relates to the sociological theories, as the characteristics of high crime areas often include high poverty areas and racial and ethnic conflict. And the theory explains that this is a result of a criminal subculture developed. So the rate of crime is directly related to the subculture that an individual is within. And this relates to the strain theory as well, because crime and delinquency are an adaptation to major sources of stress. So if there's a removal of a positive stimuli such as job opportunity, or if there's a negative stimuli present such as abuse and trauma in the household, this greatly affects a juvenile's actions. And another influencing factor is internal. So genetics are often seen in alcoholism. And the rational choice theory explains that the decision to use drugs or alcohol is based on the calculated costs and benefits of the activity, which we know that children do not have the maturity or knowledge to make a truly rational choice. So this explains that kids are not able to understand their own long-term best interests, and they often look at what's straight ahead of them, and they're unaware of laws or don't understand them, and therefore perceive their penalties not as very serious. And this relates to the techniques of neutralization, as it explains how youths justify their behavior through denying responsibility, denying injury, denying victim. And the examples that remind me of this are from the film that we watched, Halloween, with Michael Myers. He was greatly impacted by his household environment, and because he was not taken care of and bullied at home, frankly, and at school, he rebelled and participated in the activity that he saw going on with his parents. And this also reminds me of Kimiata from the Cradle to Jail film that we watched. And she just kept going through a cycle of going back to prison and reoffending because her and her mom had a very toxic relationship, and she didn't have really a great support system at home. And this leads me to prevention and treatment, which we found that poverty, unemployment, blighted cities have a large influence on drug problems rather than just attitudes of young people. And many young people become jaded by authoritarian figures such as former drug users, police, celebs, and athletes. The young people can't get drug prevention messages from these people because there's a distrust in the relationship. And treatment requires motivation offered to the individual, detoxification, a lifestyle adjustment opportunity, and it's always expected that there's a relapse possible. One of the articles that I read focuses on psychological trauma and substance abuse, and it urges that there's an understanding and appropriate response towards the disorders. The findings from the study suggest that there's high rates of trauma exposure and they're linked to substance abusing populations. And there's just a general numbness and responsiveness and avoidance of thoughts. And this kind of relates back to Michael Myers. He kind of ignored everyone. No one knew what was going through his head. And there's a sense of foreshortened future relating back to rational choice theory, how kids cannot focus on the long term. And the article also mentioned that the relationship between brain development and the effects of childhood trauma is that the consequence of early traumatization contributes to onset of alcohol and drug use and heavier drinking compared to trauma experienced in adulthood. So the trauma that we experience in our childhood is way more impactful than what we experience in our adulthood and sets us up kind of for our behavior for the rest of our lives. And the second article I read focuses on substance abuse treatment in the form of patient-centered care. So the text examined a study done by Schwartz to see if less restricted and authoritarian treatment presents better outcomes than the standard care that we use. And the findings suggest that forcing individuals to go to counseling does not improve outcomes. And patient-centered care, their goal is to focus on outcomes important to patients and ask them what they want to focus on. And that gets them to engage in an ongoing conversation about their goals for treatment. And this is especially beneficial for marginalized communities who lack strong advocates. And in standard programs, participants experience societal stigmatization, which hinders their recovery abilities and their development of positive pro-social identities. So it's important that we focus on patient-centered care to really hear and understand the individual. And these are just my references for my articles, and I hope you enjoy